Welcome to Raaonline. Today's topic is something of a very simple yet very commonly seen problems in the ENT OPD. We are going to talk about diseases of the external ear. So, a little bit about the anatomy, which we have already discussed before. The external ear, when we examine, will consist of the pinna or the auricle and the external canal, which is the external auditory canal, and the part of the tympanic membrane which faces the external side. So, the external canal is divided into two parts basically anatomically. We have the lateral 1/3, which is the cartilaginous part, and the bony part, which is forms the medial 2/3 of the external canal. The pinna or the auricle consists of skin and cartilage with no subcutaneous connective tissue. Why is this important? We will be seeing later when we talk about diseases of the pinna or the auricle. The lobule, which is this part of the ear, is entirely consistent of fat. There is no cartilage present. And when you look at the external canal, that is the external auditory canal, which is S-shaped. So, it curves from the outside to the inside, and the isthmus of the external canal, which is the junction of the cartilages and the bony part of the external canal, is the narrowest part of the ear canal. Now, this is important because in case of any impacted wax or keratosis, it is the isthmus which acts as the place where the problem happens. When we come to the examination of the ear, so when we look at the ear, we first look at the pinna on the outside, the front and the back, and look at the skin, look at any swelling or redness or any ulceration of the pinna. And the point to note for in external examination of the pinna is the presence of any preauricular or postauricular sinus. Now, these are congenital conditions, and it may just be present as a small dot when we examine the ear, and rarely it can present as a small cyst-like swelling, and sometimes it can be infected. We will talk about that later. When you examine the external canal, because of its S-shaped curvature, we cannot see the eardrum directly. So, when we have to examine the external canal and the tympanic membrane, we have to pull the ear upwards and outwards. This will straighten out the canal and give us a proper view of the eardrum. In case of children, it is a straight tube. So, this just enough if you pull the canal outwards. The upward pull is not necessary. So, if you look at it, so you have the pinna, which is the auricle, and we have the helix, and the smaller curvature is the antihelix, and this projection is called as the tragus. So, you look at the surface of the skin and look for any condition which usually affects the skin. Now, this is the view of the eardrum or the tympanic membrane. This is the cone of light or the umbo, and this is the malleus which is seen. So, normally the ear canal is pink in color. So, the ear consists of hair follicles, and it is also the lot of sebum which is secreted, and this with the desquamated epithelium together form the wax. And wax is important for the ear because it helps keep the ear moist and it lubricates the ear. And the mechanism of wax formation and wax clearance is it is a self-cleansing mechanism. So, the hair follicles push the sebum out towards the external meatus, and normally it cleans itself. Now, in some people, there is excessive wax secretion which happens. So, the wax is of two types, which is dry or wet. And in case of wet wax, what we find is the patient's extreme wetness of the ear. They will feel that there is always some foreign body sensation in the ear, some itching. And when we examine the ear, nothing will be there except wet wax. And in some cases, the wax dries up, then this leads to accumulation which needs to be cleaned. Now, the increased formation of wax is seen mostly in elderly, which is usually the dry form of wax. People with mental retardation, again the dry form of wax. In case of allergies, is usually either wet wax or dry wax. Impaction of wax in the ear canal can lead to a conductive hearing loss in some cases, especially in cases of keratosis obturans and conditions which completely block the external canal. The other conditions which lead to wax accumulation is anything which obstructs the flow of the wax. It could be a foreign body, it could be osteoma or a furuncle in the ear which prevents the wax clearance, and in people wearing hearing aids and people using earphones a lot. So, this is something which we see a lot in the recent past, where people have the habit of using these earplugs throughout, and these persons, there is a possibility of the wax not coming out and delay in clearance, leading to accumulation of wax, further leading to impaction of wax.